Chapter 4, Video 1. In this chapter, we're going to talk about the advanced urinary care skills, and there's several things that you guys are going to need to be familiar with, and one of these is the insertion of the urinary catheter. A cath is inserted into the bladder through the urethra, or it can be done through an incision made in the abdominal wall. So there's several different things that I want to point out to you here. First, we're going to talk about the three different types of urinary catheters, okay? We have a straight catheter, an indwelling catheter, and we have a suprapubic catheter. And I really want you to be familiar with this slide. With the straight catheter, the catheter is inserted into the bladder and urine is allowed to drain out, and then the catheter is removed, okay? We use the straight catheters when we are collecting a sterile urine, or if there's obstruction in the urethra causing temporary pain or swelling and the urine is unable to flow freely from the bladder, or when a person has a condition that affects the ability to sense the need to void. So basically, the bladder is filling up with urine, but it's not expelling out through the urethra. With the straight catheter, we went over in lab, we went over the Foley catheter, the indwelling or the Foley catheter that has the bubble on the end and it seats in the bladder and it stays in the bladder. With the straight catheter, we don't have that bubble. And I will show you guys one in lab. It's really easy. Your technique is the same, except that you just put this catheter into the bladder, you drain the urine out of the bladder, and then you remove this catheter so it does not stay in. If you go down and you look at the indwelling catheter, this is what we went over in lab. Again, it's inserted in through the urethra and it provides continuous urine drainage. So with the Foley catheter or the indwelling catheter that we put in lab, it goes up into the bladder, and then right here at the bladder, that bulb is inflated and it keeps it from pulling back through the urethra. So once you get it up in there and you inflate that bulb, it can't pull out because that bulb makes that tubing too big to come back down through that urethra, and it just seats in the base of that bladder. And then the urine is able to drain out continuously, so you just watch their bag and see when it needs to be emptied. You may see a Foley catheter inserted during surgery, or if they need to carefully monitor I's and O's, if they need to know exactly what this person is dealing with as far as their intake and output. If they're unable to urinate because there's an obstruction, in males, a lot of times they'll have an enlarged prostate that doesn't allow for the urine to flow freely. Or if they have a wound and they're incontinent, they're not able to control their urine, a lot of times they'll put a Foley in so that person doesn't urinate all over themselves and urinate in that wound. And then with the suprapubic catheter, it's not actually put in through the urethra. There's an incision made in the abdominal wall, and it goes straight into that bladder that way. So it's made by an incision. They often use these if a person is required to be catheterized for an extended period of time. And the reason they do this is because if you have a Foley catheter put in through the urethra and it's there for an extended period of time, that can be very painful and uncomfortable for the patient. And inserting a Foley catheter, as you know, is a sterile technique. Again, there's different reasons. Surgery, if they can't void because they're having temporary pain or swelling, or if the urethra is blocked, these are reasons why you would have the catheter. Again, to closely monitor intake and output. Caths may be inserted for retention. Again, if it's in retention, we're going to insert a straight cath for this distension. We're going to measure the amount, the urine obtained. We're going to report color. We're going to report clarity and how the patient tolerated it. We always start with a straight cath when we're thinking about retention, and we'll empty out. So we'll start with the straight cath, and then hopefully we'll get them back going on their own and independently. But if we don't, they may advance from doing straight caths straight into an indwelling or a Foley. I think we've gone over all of this previously. When we use catheterizations when we need a sterile urine. Again, if they have a wound, we may put in an indwelling to keep the urine out of that wound. There's risk associated with urinary catheterization. The risks include infection. It can begin in the bladder and it can travel up the bladder to the ureters and then to the kidneys. We could have a urinary tract infection. Most common is an HAI. An HAI, remember, is a hospital-acquired infection. If we do not use sterile technique and we're not careful when we insert a Foley catheter or a straight catheter, we could cause that patient to get an infection that would result in an HAI. We put them at risk with urinary catheterizations. They're at risk for urethral trauma. It occurs when trying to force the catheter through the ureter, damaging the mucosa that lines the urethra, leading to bleeding, swelling, and higher risk of infection. Urethral trauma is greater in men than in women because of the length of the urethra and the curvature. In addition, the male has a prostate, and we have to maneuver around that prostate. And if that prostate is enlarged, then it can be very challenging. One type of catheter that may be used in males who have an enlarged prostate and they're having trouble getting that patient catheterized, they may use what we call a Coude catheter. It's C-O-U-D-E. Is how it's spelled. It's C-O-U-D-E, but it's called a Coude catheter, and it has a specially tipped and shaped end just to get around that prostate, so it may make it easier. When we're catheterizing a patient, guys, you need to know your steps, and you need to know what you're looking for. Having a doctor's order is a must. You must have the doctor's order. You want to make sure that you identify that patient, name, date of birth, check against their armband. A female patient is usually positioned in the supine position with their legs apart and the knees slightly bent. And you can look at box 4.1. Tell whether the following statement is true or false. You need a doctor's order to catheterize a patient. You do not need a doctor's order to catheterize the patient. The answer to this is false. You must have a doctor's order before you catheterize a patient. You cannot catheterize a patient without a doctor's order. And then again, this is our Foley or our indwelling. We did not go over in lab how to insert a Foley on a male patient, and I will do that with you guys. I will make sure that you understand and you're comfortable with catheterizing a male patient as well. But it's the same technique, but you do have the prostate here to contend with, and that can be very challenging. We need to always make sure when we're catheterizing that patient that we need to make sure that when we're using that Foley that we inject the right amount of saline into the balloon. You need to look at that balloon and see what it requires. Some require 10 mLs, some require 30 mLs, some require 5 mLs. So you need to make sure that we put the right amount in there. If that catheter calls for 10 milliliters, we don't want to put 30 because that's going to compromise the integrity of that balloon, and the patient can end up pulling the catheter out because the balloon ruptured. If the doctor has ordered for a 30 ml balloon, maybe this patient has had a Foley catheter for a while and things are stretched out and not like they should be. If it calls for a 30 ml balloon and you put a 10, then you run the risk of that patient pulling that catheter out and traumatizing their urethra. The purpose of inflating that balloon is to hold the catheter at the base of the bladder, and we don't want to forget to deflate that balloon before we remove that catheter. So when you're checking off, please make sure to be careful with that. An indwelling catheter is considered to be a closed system. So when urines pass through the urinary meatus and into the bladder, the balloon is inflated, which holds the catheter inside of the bladder. But it's closed because urine's coming through that tubing and going into a bag. There's a way to disconnect these catheter tubings, which I can show you guys in lab. Which catheter is inserted into the abdomen to drain urine? The correct answer to this is going to be the suprapubic catheter. It is inserted by a surgical opening in the lower abdomen in the pubic area, and it goes straight into the bladder. If you guys have any questions, please let me know. That is it for Chapter 4, Video 1.